Welcome to the Every Ancillary podcast. I'm your host, Michael Berg, joined as always by Viv Hudson. Viv, we got a special guest today.
I know. I was getting sick of talking to you, so I thought it was time that we got in another guest, so I didn't have to listen to you go on and on. So
Still
welcome,
get some of that.
Dave Minsky.
Yes,
Welcome,
Dr.
Dave
Dave.
Minsky. Yeah, so happy to have you, Dave. Dave's from the Dr. Referral Institute, and he's got a pretty unique little program. So we're going to tell you a bit about today. So welcome.
Thank you so much for having me, guys. I appreciate it.
So, Dave, I have seen people in practices before, as I've done my rounds in the past, who are there bringing in brochures for a gastroenterologist, for a cardiologist, for a surgeon, or what have you. And I'm just kind of watching what they do. And effectively, what they are liaisons that practice hires on their own dime. And they're out there basically hustling for referrals. And when I saw your program, I was really attracted to it because, well, I'm going to let you explain what it is that you do, but I could just see how effective it was having this liaison actually be hands-on and explaining the benefits of using that particular specialist. So why don't you tell us a little bit about what DRI does?
Sure, absolutely. Well, thank you for that. So we all know in practices that, for an office, busy does not mean they're profitable. It does not mean they're seeing the cases that they truly want to see in their office. One thing we use all the time is that, if your loved one had something wrong and you need to go see somebody for a condition, you got a few different choices. Maybe you heard something on the radio, you saw something on TV, maybe you got an email or a direct mail piece about them, or you were referred to somebody. Well, we all know you're going to pick the person you refer to because they're trusted and credible. And that's exactly what Dr. Referral Institute does for our clients. We make sure we're consistently in front of referring providers. So when the cases come across the desk that our clients are good at, paid well for, they think of our client versus everybody else that's in the industry. So we want to make sure that not only we can help doctors in their practice, but making sure they're really helping the patient by making sure patients are seeing the providers that they should for whatever condition, that they're being sent out by their primary care physician.
From your experience so far, how are most practices handling their marketing?
Yeah, so a lot of them, they understand how important referral development is, but they usually don't understand what it really takes to build and truly nurture relationships. See, they'll try to have it as a splash. They'll show up once in a great while, or they'll come out during the holiday season, to try to nurture those relationships. But really, one of the favorite time for our team around the country coming up here is the holiday season, because, our biggest thing is, guess what? Here's your information that we're giving you. And, oh, by the way, we're going to be back in January and February, where a lot of other practices, don't really nurture that relationship consistently. And that's really where we see them falling short, is either the doctor themselves is trying to go out and build that relationship, or maybe they have someone in the office who is wearing 10 different hats trying to do it also, but there's really not a true systematic approach to referral development. And that's really what it takes to be successful.
And I know you have a clinical background, Dave. How important are referrals to a specialist versus just driving in patients through some other form of marketing?
Referrals are everything, right? Because you want that patient already screened to be the case that you're looking for, the case that you're good at, the case that you're paid well for, the case you're going to get your best results. So, in my opinion, referrals are everything to build a truly quality practice. A lot of times, doctors spend all kinds of money on ads and TVs and billboards and things like that. And you ask people, would you really go to a doctor off of a billboard you saw? And it's not, right? It's off of someone they were referred to. So I think for any true sustainable practice, referrals are how that happens.
So actually looking at referrals, what specific kinds of referral would you say that your company offers for physicians?
Yeah, so everything we do is to previous, any type of referring providers. So when we start with clients, we do what's called the new client checklist, right? A little backlog of what they may be doing currently, what the history of their practice is. one thing I would say is probably the biggest mistake in referral development is taking for granted existing relationships. So for example, Dr. Smith sent them 10 referrals last year. They may be like, hey, don't worry about Dr. Smith. Well, let's worry about Dr. Smith. Let's protect that relationship, enhance that relationship. And if they send you 15 this year, well, you just increase that business by 50% from that referral source. So a lot of times the true value in the referral relationship is really overlooked by some other things versus truly having quality patients, come through the door who are going to follow through with your care, which is also a very important part of it. The other thing is going to be from the patient perspective is, right now with the doctors, everything being tied to value-based care. And for the patient, right now there's millions of inappropriate referrals. And an inappropriate referral would be, okay, so you hurt your knee. You go to your doctor and he says, yep, you got a knee injury. Here's a card, go see the ortho. So you go in, you see the orthopedic, you get in the office, doc says, yep, you got a knee condition. Problem is, I'm the shoulder person. So why don't you schedule with my partner and they can go and take care of your knee? Well, that happens millions of times a year because they're not having consistent communication with those referring providers to make sure that the doctors are seeing not only the cases that they're good at, but they should be seeing for that patient also.
So who are the people who these referral building specialists, I think is what you call them? What can you tell us about those people? Where did they come from? What should the doctor expect from those specialists?
Yeah, good question. So, sales in healthcare is a unique breed, right? Not everybody can do it. It's not easy getting past the gatekeepers. It's not easy being consistent in front of the office and creating value. So our team across the country are all previous pharmaceutical reps, medical device sales, doctors, nurses, consultants, people who have backgrounds in healthcare, who understand how to open doors, build, nurture relationships, and ethically represent who our client is. It's very important for us to have professionals because, again, you're talking about the doctor's name and their reputation. So that's who our team is across the country, is people who are truly vested in healthcare and understand the industry.
And what are the what's the benefit to the practice? Like, how quickly are they going to see the results from this program come in, and what kind of budget are they going to need to be able to do this?
Good question. So one of the biggest goals when I started this company was to make sure that we had something affordable for physicians that was truly systematic, that got them the results that they're looking for. So when we talk about offices, we want to make sure we match them with wherever they're at. One of the big things that's important for us is anytime you talk about referrals, you want to make sure that your program you're offering is compliant also. And there's many out there that might be. You can't get paid for referrals. So for all of our programs, it's set up as a flat fee per block of marketing contacts that we go to for offices. So it makes it very clean, very black and white. It's a flat fee, whether they get in 15, 50, or 500 referrals, the fee is exactly the same for whatever block that they are providing. So we have programs, remote programs that are as low as $800 a month, and some offices will pay us $20,000 a month. It just depends on what that office is looking for as far as that reach. And we do an evaluation for them also to see what might be appropriate for what they're looking for. And one of the other things is going to be is starting with these offices, communication with them is essential because they want results now. And so what we do is when we do an eval for the office, we'll be able to go and see not only existing, relationships where they're at, how long has that office been in practice, what does their market look like. So we want to make sure that they're getting results, but we are building relationships. So they should not expect, and we start with them, that, in 30 days, they're going to get a 5 times ROI. That usually does not happen. But after we're with those referring providers consistently and building and nurturing relationships with them, we build trust. And one of the biggest things with building trust is that referring provider, who by far in our program is probably the biggest fan of what we do, they know we're going to be back with them. So gosh forbid something happens wrong with a patient, they wait too long or some miscommunication, we're there as a resource to provide value for them. And referring provider offices, they traditionally refer to 6 to 8 different types of specialties. So for our clients, to make sure that they have communication consistently for whatever they're sending out is of tremendous value for them, to make sure we're building sustainable practices, for those offices. So when we start with them, It's truly making sure we're consistent in front of those providers, weaning out some that may not be a fit, enhancing the ones that may be, so they're making sure they're getting the ROI they're looking for.
Seems like an easy win-win. It's almost kind of a microcosm of our Every Ancillary website, Vivien, where you're just kind of matching physicians with the right referral source, and it really almost works like a cooperative where a single physician doesn't have to take on the responsibility and the costs of having that full-time employee, and not to mention managing that employee. And we know how hard it is to manage outside sales reps. So they're paying a fraction of the fee and having that professional outward appearance to their colleagues. So I really like the idea. It's a great idea. I can see why this works for you. So what is the sales process for Every Ancillary consultants? They get a doctor who says, yep, I want to learn more. What do they do then?
Yeah, so we have, I like to make sure that for any of the sales reps that are out there, that it's something systematic for them also, right? So to make sure that we're qualifying that office as someone that truly may be interested. So what we do is we just have a one-page qualification sheet that goes with some real general basic information about that practice. And then what we do is we schedule with them a referral evaluation. There's information on that one-page form that can be, we'll get the meeting scheduled. The representative can or cannot be available. It's up to them, whatever works, if they're able to be available with their schedule. And then we go over and basically do a short evaluation of that practice to see truly if it's a fit and really what their needs are for their practices. And one thing that's important, for these practices is a lot of the questions that we'll ask and go over are things that sometimes they might not have thought of, right? As far as, what condition-specific cases do you want to market? What are your top 3 to 5 conditions that you'd like us to go after and market for them? And a lot of times it's a great opportunity for the representatives that if they have other things, that maybe there's a new service or a new device or a new something in their office has been added, it's a great opportunity to communicate that to those providers that this service is being offered or something may have changed in the office.
Dude, that is a good idea. I know a lot of people are pushing things like osteoarthritis is an example, Vivien, with a physician picking up that service would rely on or could get referrals from other physicians. So I could see some definite value there. Well, this sounds very cool. I like it. For sales reps, you don't have to sell the program. All you have to do is introduce the program. Dave and his team are very professional, and they're going to go in and they're basically going to explain all of the details and help you get it closed. So this is really more of a service that you're going to introduce to your doctors, tee it up for Dave, and then let him and his team do their thing. Viv, how do reps get started with this?
Yes, go to our platform, everyancillary.com. Make sure you register. If you haven't already, any of the new programs that we're offering will come up at the list of the top of search ancillaries. So if you go to that, look for Dr. Referral and
Referral Marketing.
Referral Marketing. Sorry, Referral Marketing. And that will link you up with everything that you need to get started with Dr. Dave. So thanks a lot, Dr. Dave, for joining us today.
Well, thank you so much for your time, guys. I really appreciate it.
No problems. Thanks.